Hello, everybody. This is Melinda with Prince Agency Insurance, and welcome to our third Thursday community conversation. Today, we're going to be focused on Medicare 101, the basics, and please reach out as we go through this with your questions. My team members will be on call watching the chat, so please enter questions that you've got into the chat as I go through this, and they may respond during the meeting, but especially at the end. All right. So you should see triangles on your screen, and we're going to talk about the basics. Original Medicare. That is a term that's used often. It refers specifically to parts A and B. And pardon me, I'm going to start my timer just to make sure that I stay on track here. Part A of Medicare is the hospital coverage. That's the one we all get premium free because we have worked and paid into the system for at least 40 quarters or 10 years. If somebody has not paid into the system for that 40 quarters or 10 years, and they turn 65 in this country, and they're a legal status to be here, they have to pay for Part A of Medicare. The rest of us get it at no cost. Part B of Medicare, which is the outpatient services, so things we normally think of like doctor's visits, lab tests, but it also covers outpatient things that are done at a hospital. So you can see outpatient surgery is listed there. Even an observation stay in a hospital would be considered coverage under Part B. B, everybody does have to pay for. I'm going to scroll to the bottom here of this page, which is our Medicare costs at a glance for this year. Okay. We're going to look at how Part A and B work separately, but first let me address that Part B premium. You can see down here that it's 202 and 90 cents. I'm going to flip to the next slide here and make that a little bit smaller so you can see the whole thing. This is what is called an IRMA chart, and it's called Income Related Monthly Adjusted Amount. There, I got my thing to disappear, so hopefully you can see that at the top. So that's a bit of a mouthful just to say that people who have higher incomes have to pay more for parts B and D of Medicare. D's that pharmacy drug coverage. We'll get to how that works in a few minutes. But across this top line here is the standard Part B and D premiums. So Part B is 202 and 90 cents. And you can see the income ranges. So if I focus on married filing jointly, if 2 years ago, in 2024, your modified adjusted gross income was $218 married filing a joint tax return or less, you pay the standard Part B premium. Each spouse in a married situation like that pays a separate Part B premium. So they're looking at the joint income, separate premiums. Okay. You can see for a single person, it's half that at 109. Okay. If somebody's income goes into the higher category, so like 218 to 274, those people have to pay a higher B and D premium. So you can see the B premium goes up to 284.10, and they're going to tack this $14.50 onto your Part D prescription drug plan. And again, we'll talk about those plans in a minute, but whatever those plan premiums are, if your income is higher and they add IRMA tax on top of it, they're going to tack that on top of that premium each month and for each spouse separately. Okay. You can see as we scroll down to the bottom here, the people with the higher incomes, so married filing joint above 750,000, they have to pay their full Part B premium, which is almost $700, $689.90. Okay. I'm going to scroll back up to our triangles. Just actually, I'm sorry, we're going to go to the cost at a glance again, make that a little bigger. So now that we've covered that Part A is premium free and B, everybody has to pay for, when we pay for Part B, either we pay the government directly, CMS, the Centers for Medicare and Medicaid, and they bill quarterly, or if somebody's already receiving Social Security monthly benefits, that 200 and 290 or whatever your premium is, if you have IRMA tacked on top, is directly deducted from that Social Security check before they put it in your bank account. Okay. Let's talk about how A and B work and how what's covered and not covered, or I should say, what they're financially paying on your behalf and what you're left financially responsible for. So under Part A, hospital admitted stay, we have a deductible that is $1,736. You'll notice that it says it's for each benefit period. A benefit period under Medicare is only 60 days long. It is not an annual deductible like most of our insurances have been, okay? If you're in the hospital, you're discharged, you go home, you get readmitted again. If you're readmitted in less than 60 days, it's the same benefit period. No new deductible, but the number of admitted status days during that same benefit period continue to count on. So if you were in the hospital for 30 days, at home for 3 days, and readmitted again, it's day 31 when you're readmitted of the same benefit period. As soon as we get to 60 days of admitted status stay, whether it's all at once or in parts, we then move on to being responsible for per day charges. So we have coinsurance of $434 per day for days 61 through 90. If we stay longer than 90 days, it's $868 per day. There's even some lifetime limits on days 91 and beyond, 60 of those in our lifetime, actually. But worse than these, deductibles that start over every 60 days or per day charges that could rack up really fast, the worst part actually about Medicare financially is that there is no maximum out of pocket on your financial exposure ever. Designed in 1965, nobody decided that it was a good idea to put a max out of pocket on people's financial exposure. At the time, what they've decided over time to do is just allow us to add private insurance on top of original Medicare. So that is the number one reason that people choose either a Part C Advantage plan, we're going to talk about in a few minutes here, or a Medigap plan called a Medicare supplement. Either one of those systems, it does exactly that. It puts a maximum out of pocket on your financial exposure annually. So that's the number one reason that people would do something like that. Now let's talk about how Part B works, outpatient services. So we talked about paying for it. Now when we go to use it, we have a deductible that is only once a year, and it's rather low at only $283 currently. Once the deductible is met, then coinsurance, 80/20. The government pays 80%, we're responsible for 20% of the Medicare approved amount. If something is above the Medicare approved amount, which most of the time things are billed out at a higher amount than the Medicare approved amount, it is possible, if we're at a participating Medicare provider, that they would just write off the difference. But if we're at a non-participating Medicare provider, they're allowed to balance bill us, what are called excess charges. And that would be the number two reason that people would add either an Advantage plan or Medicare supplement. Stops those two things. One, it stops unlimited exposure by putting a max out of pocket on your financial exposure for the year. Additionally, either one of those would stop balance billing of excess charges in most cases. Okay. In most cases, I'm saying because some Medigap plans would still allow it. Not usually the ones we recommend, but they do exist. Okay. So first, I'm going to then go into, if we're considering Medigap supplements or Part C Advantage plans, what's the difference, right? Let's go over Medigaps first and how those work, and then we'll circle back and do Part C Advantage plans at the end, okay? So if you look at this illustration, I often call it building blocks of coordinated parts. Part A, hospital coverage. Part B is your outpatient services. Those, when you have services done at either of those, inpatient or outpatient, those bills are going to get billed directly to the government under Medicare. They're going to pay their portion. They're going to say you're responsible for all this stuff down here in green we just talked about. Okay. Then in this scenario, you hire a private insurance company by purchasing a Medigap supplement as a secondary payer to original Medicare. They pick up the remaining part of the bill. It's a slight oversimplification. I'm going to scroll down to Medigaps. It's on my third page here. There we go. Make it a little smaller so you can see it. All right, Medigap plans A through N. Left column, these are the parts of Medicare that would be covered if you follow it along horizontally and you see a green check mark under that letter. It means it would cover that part of Medicare for you. Red X, it wouldn't cover it. You'd be financially exposed. So as an example, let's start here with Part A deductible. That was the every 60 days, the 1736 number, right? If somebody's enrolled in a Medigap Plan A, you can see there's a red X next to the Medicare Part A deductible. So it wouldn't pay it on your behalf. It would flow through. You'd be responsible for it if you get admitted to the hospital. But the Medigap plans B, D, and G, green check marks, they would pay it on your behalf. The K, L, and M, they'd pay a percentage of it, and so forth. Okay. Next line, Part B deductible, red X's across the board. There is no Medigap plan left that will pay your Part B deductible. There were some old ones, an F and a C, that were eliminated a few years back. If somebody is older and they have a Part A effective date that predates when those were eliminated, they could still enroll in an F and a C that actually do cover the Part B deductible. But those of us who are younger than that, those aren't options for us anymore. Government just wanted everybody to have a little bit of skin in the game, if you will, and pay something toward their medical costs. So they've eliminated Medigap plans being able to pay your Part B deductible across the board. But the next line is probably, in my opinion, the most financially significant, Part B excess charges. So remember when I said you could get balance billed if something is above the Medicare approved amount? You'll notice there's only one green check mark there. That happens to be a Plan G. The rest of them would leave you exposed. As I mentioned, there are Medigap plans that leave you exposed. Those would be the other ones, okay? So that's how a G works. And an F and or sorry, the F's eliminated, that the A through N options as a secondary payer. So A and B pay first, Medicare supplement pays second. Some people get confused by thinking or saying whatever the insurance company is for the Medigap plan that we might be looking at, they say something like, oh, I know my doctor doesn't take X, whatever the name of that insurance company is. And I describe it actually doesn't matter when we're talking about original Medicare with a Medigap plan. Because original Medicare is national. You can go nearly anywhere as long as they're willing to bill original Medicare. You have participating and non-participating. Participating would write off the difference. Non-participating would possibly balance bill you. And that's where we would probably recommend the Plan G at Prince Agency if somebody was going to go with the Medigap plan choice because it covers those excess charges. But it's a secondary payer. They don't make any decisions on their own. They're not a network of providers. Doesn't matter if a doctor's in network or not, or a lab or, a hospital even, right? All that matters is, did they bill Medicare first and did Medicare approve the claim? As long as they approved the claim and they paid their portion, your Medigap plan is billed as a secondary payer. They pay their portion according to whichever Medigap plan you're enrolled in, okay? Doesn't matter about networks at all, okay? So then we do at Prince Agency, we review market analytics. There's a lot involved in choosing a Medigap supplement plan. It's usually something people stay with for a long period of time. So we want to make sure we're choosing a company that is stable, has good ratings, is likely to be around and not leave the market. Medigap plans are no medical underwriting when you're brand new to Part B of Medicare, okay? So when we're brand new and we can go in with no medical underwriting and get a preferred rate, you can keep that preferred rate as long as you keep paying your premium on that Medigap plan, okay? Premiums do go up every single year, but they are not according to claims, okay, or medical conditions or anything like that. But 6 months past your Part B effective date, if you ever want a Medicare supplement in the future, like your premium's gotten high now and you want to switch to another company and get medically underwritten, they get to ask health questions and decide if they want you or don't want you, okay? But you can't get kicked off of your Medigap plan because of any medical claims, right? But premiums do go up every year, okay? We're going to switch to, actually, no, hold on. One more. We forgot the D. I forgot the D. So A, hospital, B, outpatient, and the Medigap supplement just picks up the leftover cost. If A or B didn't cover it, your supplement doesn't cover it either, because again, they don't make any decisions on their own. So what are things that are not covered by original Medicare A and B? Dental, vision, hearing, maybe the free gym membership you've heard about under some Medicare plans, debit cards for over-the-counter items and things like that. We're going to talk about those in Part C plans in a few minutes here, okay? But original Medicare don't cover those things. Supplement doesn't cover them either, all right? Additionally, prescriptions you buy at a pharmacy, right? A is hospital, B is outpatient services. Neither one of those covers drugs you purchase at a pharmacy. So if you go this route with original Medicare and a Medigap plan, you have to purchase a standalone Part D prescription drug plan, okay? There are many choices out there. We help you evaluate your specific list of prescriptions, dosages, all of that. Which plan would be most appropriate to give you the overall lowest cost for the year, pharmacy you'd like to use, things like that. Part D, prescription drug coverage. There's a deductible stage that goes first. Often on tier 1 and tier 2, the most inexpensive medications, most plans let you skip the deductible for those, and you don't really incur a deductible until you have more expensive medications like tiers 3 and above, brand name drugs, things like that. Okay. Whether you skip the deductible because they're inexpensive or you pay through it because you have a brand name drug or something, once you're through the deductible stage, it's then co-insurance or co-pays. So most lower cost drugs are co-pays, a few dollars here and there. If they're the higher tier drugs, they're usually percentages. And then ultimately, there is a maximum out of pocket on your financial exposure now under Part D coverage. For this year, it's $2,100. Last year was 2025 was the first year that that was instituted by the government. It was $2,000 last year. And I've heard that it is projected to be $2,500 maximum out of pocket for 2027. So that's not confirmed yet, but that's where it's estimated at for next year. Okay. So that's A, B, Medigap plan, and a D. Altogether, you have separate pieces and parts that coordinate together. Okay, this is a 3-card system. You're carrying around the red, white, and blue Medicare card and the supplement card. They're like married to each other, never to be separated. One pays first, the other pays second. And then you have the pharmacy card, Part D separate, that you use at the pharmacy to purchase prescriptions. Okay. So that's how that system works. We're going to go on and talk about Part C Advantage plans now. And you can kind of see by that blue triangle, it kind of covers up or replaces original Medicare. This is actually a system where the government subcontracts to private insurance companies to pay them to provide your Medicare coverage under one complete package plan through a private insurance company. So they put your A, hospital coverage, your B, outpatient services, and most plans have your Part D prescription drug coverage included as well, complete package. There are Part C Advantage plans that do not have Part D included. Those would work for like veterans who can get their drugs covered through the VA and not have a penalty. But then an Advantage plan is a system where you pay a little bit as you go, mostly copays. So a copay, most of the time, the copay to the primary care doctor is zero on most plans. The specialist copays can range from $35 to $55 currently in those ranges. You pay as you go for different things. As those copays add up for each service that you have done throughout the year, they count toward your maximum out of pocket for the year. If you reach it, you get 100% medical coverage for the rest of the year. The Part D prescription drug coverage that is included in the C is separate from the medical. Yes, it's a complete package, but the D coverage is a separate part of the plan, and it follows the same as the standalone Part D does, where deductible stage, copays or co-insurance, and max out of pocket of $2,100 for the year. Okay. The medical side, pay as you go till you hit the max out of pocket. On average in 2026 in West Michigan, probably in about the $600 or $6,000 range, excuse me, would be the maximum out of pocket. Depends on the plan and the carrier. And you can switch Advantage plans from one year to the next. There's never any medical underwriting questions asked, no matter whether you're brand new to Medicare or it's 10 or 20 years down the road and it's time to switch plans for some reason. Okay. Reasons for plan changes, they can be, I got a new prescription and a new diagnosis, and this other carrier is going to cover that drug better for me next year. So we're going to switch plans. Another choice might be, I chose a PPO at the beginning because I wanted to travel a lot and see grandkids in other states and have see doctors on a non-emergency basis outside of Michigan, right? And I wanted a PPO so I can go in and out of network. Now I'm a little bit older and I've got more medical conditions going on, and PPOs can sometimes have a higher maximum out of pocket. And as we get older and maybe more medical conditions, maybe we want to focus instead on that lower max out of pocket, right? I've every year, unfortunately, it seems I have clients that come my way during enrollment season that have a new diagnosis, and we're focused on doctors in network because Advantage plans are about networks. Yes, there's PPOs where you can go in and out of network as well, but generally speaking, you're going to spend less on in-network providers. So we're checking to make sure continuity of care is maintained by choosing in-network providers, right? And choosing a plan that works with those providers that they want to keep, right? So as we do those reviews, sometimes we're focused on health and wellness, and there are plans that have lots of extra, like gym memberships and things like that included in them. And other times we're focused on managing some chronic health conditions, and we've got a lot of specialists to see, and we want to make sure that those copays are low and manageable, right? So Advantage plans, very flexible from one year to the next. As long as the plan's available in your county, you can choose to switch, no medical questions asked. Okay. That Medigap supplement, no medical questions only at the beginning when you're brand new to Part B. 6 months later, you got to go through medical underwriting. So if somebody started with a Medigap plan first, when they're first eligible, no medical underwriting questions, and later they want to move to an Advantage plan, no questions asked. You can do it. Just has to be done at the annual enrollment time that's in the fall, October 15th through December 7th, and then that new plan takes effect January 1. If you do it the opposite, and somebody chooses an Advantage plan at the beginning when they're first eligible for Medicare, and later you want to choose a Medicare supplement, as long as you're 6 months past your Part B effective date, the Medicare supplement company gets to ask medical underwriting questions. One of three outcomes. Healthy, yep, come in, we'll take you, we'll give you a preferred rate. Healthy tobacco user, come on, we'll take you, but we'll give you a standard rate. Or three, no, there's medical conditions, we don't want to take you, declined. Okay, those are the three options under a Medigap supplement. Okay, if you have to be underwritten, that is. Again, at the beginning, no underwriting. So um, there are lots of options, and everybody's situation is very specific. Enrollment periods, there are many, unfortunately. The biggest one, when somebody's turning 65, since we're doing a Medicare 101, it's a 7-month period of time. The month you are eligible, and that's either if your birthday falls on the second through the end of the month, your eligibility is of the first of that month when you turn 65. If somebody's birthday is on the first of a month, their Medicare eligibility goes to the first of the previous month. Okay, so whatever your eligibility month is, think of that as the center, and you get 3 months before and 3 months after, 7 months total, okay, to get enrolled, and the three parts that are required. A, B, and D. Okay, those are the three parts subsidized by all of us, the taxpayers. They have to take you, they have to cover pre-existing conditions, subsidized. Everybody's got to participate. Or if the healthy people decide to stay out of the risk pool and say, yeah, I'm not going to buy that drug plan for now, I'm going to wait 5, 10 years till I have more expensive prescriptions, you get penalized. And it's 1% of the national average cost times the number of months you went without it. There are $0 premium drug plans and Advantage plans. There is no reason anybody should go without a drug plan or Advantage plan if they're eligible for Medicare at this point. It can only hurt you later. Okay. Some people decide to work longer, and maybe they've moved the goal line on us on Social Security at this point. Most people's full retirement age is at 67. But Medicare is still, your eligibility is at the age of 65. So once you've reached that month of eligibility, you must stay in compliance with the Medicare law for the rest of your life. That means you have to have A, B, and D, or a large group employer plan. So if you or a spouse is still working and has a large group employer plan, large group is defined as more than 20 employees on that group plan. If there are less than 20, it's considered a small group plan by the government, and it does not meet the requirements of Medicare. You would then have to add A, B, and D instead of the employer small group plan. Okay. So if that is your situation, please reach out for help. Every year I have people that don't understand how that works and end up with penalties as a result. So large group plans, though, you could stay on those. It's pretty common at this point for large group plans to be health savings account or HSA plans, and people and their employers are making HSA contributions. I won't go into the details of that in this Medicare 101 presentation, but I would encourage you to please go to our website, princeagencyllc.com. Click that About tab and go to the Third Thursday recordings and review the HSA video that I did about a month ago. It goes into more detail about what you need to look out for if you're going to stay employed past the age of 65 or on an employer's plan, maybe it's your spouse's plan, and continue to contribute to an HSA. Okay, if you enroll in Medicare later, Part A gets backdated 6 months, and there are problems with over contributions there, and you would want to reach out and just make sure you get specific advice. So I hope that I've covered enough today to basically explain that there's enough choices, variations, letters, for goodness sakes. Employer coverage. Do I not have employer coverage? Large group, small group. Do I have an HSA? Do I not? Our advice is always, please just come get a free evaluation. It never costs anything to use our help. To choose a Medicare product, whether it's an Advantage plan or a supplement, the cost for whatever that product is you choose is exactly the same, no matter whether you try to figure it out all out on your own or you use our help for free. So insurance companies love when you use agents because it helps them ensure that somebody's on a plan that they chose with a little bit more thought, right? And it actually cuts down on the customer service on their end. So please reach out for help sooner rather than later. We always do reviews as soon as people reach out. Love to help you lay out that time frame and that map in front of you of how long it's going to take and timely when you need to do certain things to avoid penalties and mistakes, like HSA over contributions, or, I didn't enroll because I was on a small group plan and I thought, I didn't have to. All of those things happen each year. So again, I am Melinda with Prince Agency Insurance, and my team is in the chat. So if you've entered questions along the way, hopefully they're answering some of those as we go. But please stick around and feel free to ask additional questions, and they will call them out to you. And if it's just I need help, put that in the chat too, and we'll reach out to you. Okay. Take care and be well.